Good afternoon, Chairman Cox, Supervisors, CAO, and Board. It's an honor to virtually join you. And thank you, Supervisor Fletcher, for this opportunity to speak about the value of mobile crisis response teams for our region. As DA and joining with law enforcement, one of the biggest challenges is the clear intersection between mental health, substance abuse, and homelessness in our region. It's a challenge that's being faced around the country. And the question that needed solutions was posed at a 200 stakeholder forum that worked together, including the sheriff and law enforcement at the table, leaders from NAMI, our mental health systems, all working hand in hand for the service of our community. And we are discussing an important item today, but it is in combination with the continuum of care that provided places where people with mental health issues can be taken, the expansion of our substance abuse. And from the bottom of my heart, I want to thank each supervisor who has worked diligently on this issue, because the goal is to provide compassionate treatment to those with mental health issues and with substance abuse, but to also keep our region safe. And that is the struggle. 54,000 calls did come in involving mental health last year, and looking at those calls and trying to categorize them, some of them absolutely will continue to require a response by law enforcement. However, there is a high statistical number where law enforcement is called because we have no other alternative. It is mothers with sons that have stopped taking their medication, that can't get their sons to take their medication. It is people that don't know where to turn for help, that need another voice to calm down the situation. It is suicide calls that leave officers with very few options when they show up. Our region created one of a kind that has been a model PERT system, the psychiatric response system, but at times they're not able to respond all the time, and sometimes it's not safe for them to go into a situation until police are there. Thus, they responded to 10,000 out of the 54,000 calls that law enforcement had to respond to. This has been a work in progress as reflected by board actions on March 26, brought by then Chairwoman Diane Jacob, and June 25th, where an implementation was moved and voted by all of the supervisors to begin a pilot in conjunction with all of the other solutions. I'm happy to report that Luke Bergman, our office with the sheriff, working with dispatch, working with the mental health systems and community, have much of this work well on its way to benefit our community. And as always, sometimes starting with a pilot is a good idea, and it was on June 26th. But of course, the goal and the vision is for every member of our community, wherever they are, to receive this benefit of enhanced systems that are expert in supporting mental health, substance abuse crisis in the best way possible, in a tiered approach that's balanced and smart, that reflects the needs of the individual and their family and the safety of the community. So that tiered system would involve that evaluation, whether it's by dispatch, 211, or the access hotline, of whether this is a police response with PERT, whether this is a community clinical behavioral response, or whether this is a supportive after call follow-up connecting families with services. I know that we can do this, and I know that there is the commitment already by the county and the support of law enforcement on this item. Like Supervisor Fletcher noted, police officers are put in situations that are often untenable, where a psychology degree is required versus a law enforcement academy. And so I view this as an item that is supportive of community, of law enforcement, and of our vulnerable mental health population. So I thank you for the opportunity to speak, and thank you for putting this item forward.